In our lifetime, we go through a lot of changes, and these changes we adapt to. But sometimes the situations and events can be so overwhelming that it surpasses our capacity to control them. These events and situations then become stresses for us. These stresses can bring in emotional and behavioral symptoms. These emotional and behavioral symptoms can be low mood, anxiety, lack of sleep, lack of concentration, headaches, being cranky or irritable. When these emotional and behavioral symptoms bring along with it significant distress to the person concerned and impairment in the person's functionality, and if it occurs within 3 months of the onset of the stressors, then it is an adjustment disorder. The stresses can be many kind. It can be minimal, like moving to a new place or moving to a new job, or it can be moderate to severe intensity, like loss of a person whom we love, loss of parents, divorce, etc. Generally, these symptoms last for a period of 6 months, because by then the stresses may have disappeared or the person may have adapted to these stresses. But sometimes when the stresses are persistent and when they are occurring again and again, the symptoms may persist beyond 6 months and the symptoms may be prolonged. It is very important that adjustment disorder is treated, because in our OPD or outdoor patient settings in mental health care, about 5 to 20% of the patients are of adjustment disorder. Treatment can be both medications and psychological processes. Medications which act to overcome the crisis, and as well as medications are very well tolerated. Sometimes when the symptoms are prolonged, some medications which work on the different receptors, the serotonin receptors, the norepinephrine receptors, are very well tolerated. Besides, psychological processes like cognitive behavioral therapy, interpersonal therapy, supportive therapy has its own role to minimize the stress, to help the person come in terms with the stress, and to develop good coping skills, emotional regulation, and adaptive ways to deal with it.